And finally on the program, the Lagos State Health Management Agency has announced plans to commence the full enforcement of mandatory health insurance for all residents by the third quarter of 2025. This was announced by the Permanent Secretary of the Lagos State Health Management Agency, Dr. Emmanuel Azamba, during LASHMA's 2025 first quarter media engagement at Alausa in Ikeja.
Since the year 2020, some residents of Lagos have been enjoying the affordable healthcare services provided by the Lagos State government through the state health insurance scheme called Ilera Eko. The Lagos State Health Insurance Scheme, under the supervision of the State Health Management Agency, is constantly making healthcare services a lot easier by initiating various healthcare plans for all social status. The 2025 first quarter media parley, organized by the Lagos State Health Management Agency, provides an opportunity for the agency to reel out what has been achieved so far and the new initiatives available for residents under Ilera Eko.
Our goal is to ensure that Ilera Eko remains in the forefront of public consciousness and that more Lagosians enroll onto the scheme. Today, we are excited to share some of our major initiatives which will further drive health insurance uptake across the state. One of these is the Ilera Tiwa Cooperative. It is a strategic initiative designed to bring the informal sector on board by providing flexible payment options for artisans, traders, and low-income earners. That Ilera Eko is mandatory for every resident in Lagos State. For those who are yet to enroll, registration has been made simple and accessible. You can register at our head office, the Good Shepherd House opposite Alausa Secretariat Ikeja, at our divisional and sub-divisional offices, kiosks that are across the state, or at any community pharmacy or provider under the Ilera Eko scheme. You can also self-register via our USSD code, *6700*006#, or visit our website at www.lashma.com. Especially with all this economic hardship, once you have made your payment, you are rest assured that even if you have 0 naira in your pocket and you walk into your facility that you have selected, you will get care, and your family will be covered. So you can, at least kind of confirm some level of quality of life for you and your family when it comes to your health. Somebody asked a question about how many lives we are on now. We are about 1.3 million lives and counting. That is where we are now. We have come up with these new initiatives, and we are hoping that those initiatives will help us to even grow in quantum leaps.
In a push to expand the number of Ilera Eko enrollees, LASHMA has also introduced an enterprise platform that will boost the income of those who attract more residents to the health insurance scheme.
What we have done is to institute a financial inclusion strategy by putting in place Ilera Tiwa multipurpose cooperative society for members who are willing to pay small to join for the purpose of financial inclusion. The moment they join, they will have the opportunity to have benefits that has social impact and, of course, an embellishment and complement of economic impact. They will have access to get loans after 6 months of active membership, which is twice the amount that they have. They will also have the opportunity to have the unique advantage of earning rewards in form of cash. Extensively, because we are big on feedback and research, we discovered that the most consequential reward that Nigerians care about is cash reward. And so, therefore, we are using a multi-level marketing approach to compensate every member who is able to convince another Lagosian to be able to join Ilera Eko. So, therefore, we have technically introduced an enterprise platform for people to be able to build a nest of income for themselves. And so there's a grand reward prize even every year for people that can do better than the other while introducing people, other residents into the cooperative. So in addition to this, the cooperative has come to stay. We're piloting it, and then it will begin to run full throttle as from next week.
LASHMA also highlights the legal framework backing the health insurance scheme in Lagos State.
Since federal law has now made it compulsory to subscribe to a state social health scheme, the executive governor of Lagos State, Governor Babajide Olushola Sanwo-Olu, deemed it expedient to issue an executive order to this effect. And that is the Executive Order EOBOS01 of 2024. And this is the Executive Order on compulsory subscription to social health insurance by all residents and workers of Lagos State. And this says that it is compulsory for all residents, employers, and workers in Lagos State to subscribe to the state social health insurance scheme, which is Ilera Eco. We are going to begin to roll out the use of lateral IDs at healthcare facilities. So Ilera Eco enrollees will now be able to use lateral IDs at healthcare facilities for verification. And this is set to roll out in second quarter, and we are going to begin with 100 facilities. We are going to begin enforcement in earnest by quarter 3, 2025. And the agency is currently conducting extensive public awareness. We're engaging the public, we're engaging stakeholders, and we are refining the enforcement modalities so that we can roll out efficiently in quarter 3.
The role of assessment and incentives in driving hospital performance under Ilera Eco Healthcare Insurance is not left out in this media engagement.
We do a pre-empanelment assessment. So before a hospital can even join the Ilera Eco provider network, we have to check them to see, do they even have the capacity to give quality and safe care to our enrollees? So before they even come in, we do an assessment. Next, we do a classification of hospitals into primary hospitals that provide primary care and hospitals that provide secondary care. Then, once they are in to the system, we can't just leave them alone. Quality is a journey. We have to continuously work with hospitals to improve their quality. So we also do a quality baseline assessment to see where they are, identify the gaps, and give them advice on what to do. Then we also look at the patient side, the patients that go to the hospital. What do they experience there? We want to know. We want to get the feedback from patients so that we can give feedback to the hospital and say, oh, these are the gaps that patients have identified when they access your hospital. Do better. These are the things that you need to do to become better.
We have a number of incentives that we give to hospitals that work with us. So when your hospital is empaneled, that is, they've been onboarded fully into the network of Ilera Eco, and they can now attend and provide healthcare services to our enrollees. There are a number of things that we do for them. The first one is tiered capitation. Now, a capitation is a mode of payments that you pay a fixed fee ahead for a specific number of people. So I can say I have 10 people. Sorry, yeah, it's paid every month. So like I said, you pay it ahead before the services are provided, and for a specific number of people that you are paying for. We pay it every month, so it's paid ahead.
Some of the enrollees present share their experience on how the healthcare initiative has reduced their financial burden.
People are dying because of lack of understanding of the situation, and the economic side of it. People don't even have enough to pay for the treatment. And this Ilera Eco is now doing much to help us, to help the masses. Because I count myself as the masses. Because if you say you are rich, when millions of people are not rich, you are still poor man. Excellent, the governors are doing a good job. And the member of staff that they are working, especially those that are staff at the Korodu, they are working very well.
Over 1 million Lagos residents are currently registered under Ilera Eco Healthcare Insurance Scheme. Others are advised to take advantage of the affordable healthcare services by visiting any of the physical enrollment centers across the 5 divisions of the state, or visit the Ilera Eco online portal in order to reduce out-of-pocket expenses.